Hi, this is Bobby Kimbrough, and once again, welcome to Off the Cuffs. I feel very fortunate today to have Joshua Swift with us from the Health Service, and I have August Vernon from Emergency Management, the Director. I feel very fortunate to have both of you all with me. I want to welcome you to Off the Cuffs. I feel fortunate because what's going on right now in the time that we're constantly in, I felt almost compelled to invite you all to please come and talk with our viewers and our listeners because, like myself and everyone else, we have so many questions about what's going on. And who other than to have both of you gentlemen here, what I would say the leading authorities in that field in this community, our emergency management and our health services. So I welcome you to Off the Cuffs, and again, welcome.
Hey, glad to be here.
Well, first of all, you've been with us before, Mr. Swift, and what we like to do is take maybe 2 minutes, a minute, introduce yourself, who you are again, how did you arrive here, and then we'll let Mr. Vernon do the exact same thing, and then we won't spare any time. We'll get right into it.
Okay. Again, Joshua Swift. I'm the local public health director. I've been here since November of 2018.
Mm-hmm.
I am a native of North Carolina and grew up near outside of Elkin, North Carolina, just up the road. And before here, I was the health director in Caldwell County, and I was a deputy health director in New Hanover County, Wilmington, and prior to that was the health director in Stokes County.
Okay. Vernon.
Well, thank you for having me, Ms. Sheriff. Again, August Vernon, Director of the City and County Office of Emergency Management. I've been in public safety now for 25 years.
Wow.
Spent several years in the Army down at Fort Bragg, and I'm originally from Houston, Texas. And my intent was to go back to Houston, Texas, and then I met my lovely bride and have been here since then. Again, I've got a background in the fire service, have been in emergency management for over 20 years now. And back in August of 2018, I became the director for the Winston-Salem Forsyth County Office of Emergency Management.
Wow. Both of you guys are very impressive, and I'm glad you're here. I realized it was serious when they canceled the ACC tournament. I realized it even was more serious when they have postponed, suspended the NBA schedule. But what really brought it home was when I went to my local grocery store, Walmart, CVS, Walgreens, and they were out of bathroom tissue. They were out of wipes. They were out of disinfectant. I said, you know what? This has really gotten serious. And then we started shutting down schools, closing down major events, the precautions that we're starting to take. So let's just talk about, what is COVID-19? What is that? And what is it, the coronavirus? Just tell us what that is.
Okay. So first off, COVID-19, it's a disease. It was identified in Wuhan, China,
Mm-hmm.
and it's spread throughout the world. You see, we have cases in the United States, all over the United States, and in North Carolina. With scientists and medical experts believe it's spread through the air when we cough or we sneeze, and through close personal contact. So that's touching and shaking hands, or when you get the close personal contact or you get it on a surface, if you touch your nose, your mouth, or your eyes before washing your hands, that's how it spreads and you get infected.
How long has it been? You say it was detected in China. How long ago?
It goes back, but when we first started noticing it, started looking at it, it was around November, December of 2019.
Wow. Okay. So, a lot of people in a lot of hospitals, a lot of medical facilities are being flooded. People who think they may have the symptoms, the virus. What is it? I mean, what should we be looking for?
Well, as far as the symptoms, it's fever, cough, and shortness of breath.
Okay.
They may appear 2 to 14 days after you're exposed to it. But here's the thing, in trying to get some facts out there, COVID-19, or some people call it coronavirus, but COVID-19, it typically causes mild to moderate respiratory illness. Most people have mild symptoms. They don't require hospitalization. Although there have been reports of severe illness, and then there's a small percentage that have died.
Okay. So, are we at risk? I know people saying that it's mostly or a lot of seniors are being affected by it? Is there like one particular age group? Is there something that does it attack or affect one group of population more than it does another?
Well, obviously, we're all at risk of being infected with COVID-19. The thing is that the complications are for older adults, 60 years of age or older, or those that have chronic medical conditions, heart disease, lung disease, diabetes, cancer, or other conditions that affect your immune system. So a big thing we're saying is you may be young and healthy, and you may have symptoms, you may not even exhibit symptoms, but you could pass that on to your grandma, your grandpa, older family member, or someone whose immune system is compromised. So that's why we're you're hearing that term about social distancing.
Right. So what can we do? What can we do to protect ourselves, stay safe? What can we do?
Well, first of all, this some public health 101 things that we recommend for people to do, and we recommend this for colds and flus, is practice good hand washing. Soap and water, 20 seconds, often throughout the day. Also, we're encouraging people to, hand sanitizer. You see, like you said, when you went to Walgreens or CVS or those other places, you probably, not only bathroom tissue was out, but you probably noticed there wasn't any hand sanitizer or things like that. If you do have hand sanitizer, that's good, but the best option is still to wash your hands with soap and water. Other things you can do is avoid touching your eyes, nose, and mouth with your hands. That's sort of a habit a lot of us get into. And, when you cough or when you sneeze into your arm or use a tissue and then throw the tissue away. And just like with any other illness, we're really encouraging people, if you're sick, you can stay home. Don't go into work and infect others. That's the biggest thing we would say right now.
So, Mr. Vernon, I've got to turn to you and ask you a couple questions. I know we've been going over some of the things that general questions that people have sent in. People have asked me. They ask me every day. I'm sure they're asking you every day, and we've covered those. But let me ask you this. From your 25 years of being in emergency management services, what is your opinion on this? Give me your opinion. I mean, I know that I can't hold each person accountable for their expert advice, but based on your experience, share with us. Give us some wisdom.
Okay, so, and I'm always careful with opinions, but what I will say is, number one, you have to remember we've been here before. I was trying to think back, and we've discussed it just here in the past 20 years. We had issues and concerns with anthrax, with smallpox, with SARS. Obviously, a reminder, we did go through a pandemic in 2009 with H1N1. So we've been here before. Obviously, the concerns a few years ago with Ebola. So we have done planning and response around pandemic-type issues. I would say that one of the factors we're dealing with now that we didn't have in those past events is the social media. A lot of inaccurate and false information being shared and spread on social media. We've heard about some apps that people can now download to their phones that are incorrect information. There's people taking advantage with cybercrime and spam and things like that related to COVID and those kind of things. So this is a factor we've never really had before, is all this social media driven information. What we've talked about and will continue to say, there's three sources of information, of accurate, timely information. The same information we're working with is the Forsyth County Department of Health public website, the State Department of Health and Human Services website, and the CDC website. That's where we go for a lot of our guidance and information, and they are updating those at this point every 12 or 24 hours. But some of it is being shared incorrectly or sensationalized, so we're having to spend a lot of time to make sure the right information is going out. So again, we've had plans in place. We've been through other large events like hurricanes and ice storms, and this is similar to that because of the widespread impact of it. But as far as Forsyth County, we have been talking about this. We really started focusing in January. And for several weeks now, we've been pulling together our community partners for meetings, conference calls, including the Sheriff's Department.
I know.
Our last meeting, we had over 40, 50 different agencies involved, from hospitals, public safety agencies, government, nonprofits, and others. And, of course, we've now switched those to go-to meetings, so we're not pulling large groups to get people together. So I think there was a perception that no one really started to do anything until about a week ago, and that's kind of inaccurate also. We certainly have been monitoring it. We've been communicating every day. I'm in contact with the State Department or the North Carolina Division of Emergency Management. Also, they're getting guidance almost on a daily basis from the State Department of Health and Human Services. So those partnerships are there, and we're continuing to communicate as much as we can. Obviously, some of the things that are happening related to this pandemic are unusual and have not happened before. Nationwide state of emergency, and when people hear that, it sounds very frightening. A lot of things related to a state of emergency are more about the potential for some financial support, recovery funds, disaster funds, also some logistics that we can utilize to help in the response. So we have to have an opportunity to explain what that means.
Right. I noticed that you were talking before we cut the cameras on and the mics on went hot. We were talking about this particular county, and you said we're very fortunate because we live in a larger county. The resources that we have available, the two major hospital facilities, the medical facilities that we have here, Novant and Baptist. And so a lot of people are asking the question, they call the sheriff's office, they ask me on the streets, is they say, well, Bobby, they say, Sheriff, they say, what can we do? Have we seen the worst of it? Is it going to get worse? Are there going to be, are we prepared for it? And a lot of times when people ask you questions, you don't want to perpetuate the panic. You don't want to say something that you don't have the information to. So a lot of times I try to encourage people and say, hey, you know what? We're going to be fine. We've been here before. The thing is that we be mindful of all the precautionary measures that have been given to us to follow and the things that we should do to make sure that we stay healthy, we stay clean, and we stay basically on top of this. So from your perspective, Josh, what do you think in terms of a health perspective? Do you think that there's anything we could be doing different, anything we should do? What would you say to your brother, your sister, the guy on the street, your mother, your father? Because, you know, we have what we call real conversations, transparency. And so what would you say to the people in Forsyth County, the people that are listening here, or the people that, whoever, what would you give them, advice you would give them?
Well, first of all, I mean, just some guidance. I'll give you two examples. One, my 82-year-old dad, he's in good health, but he's 82 years old. So was talking with him, and, you know, one is just to be proactive with your health. Take simple steps that can help you out in this situation. Mm-hmm. So one is he goes to the grocery store to get some groceries. You know, go during some off hours, not when it's busy. I mean, grocery stores are always busy, usually after 5 and on the weekends. So being an older adult who's retired, he can go middle of the day when it's less crowded. He was talking about last weekend a certain restaurant that he usually goes to, and he went there, but he just picked it up, got it to go, and left instead of staying in the restaurant with multiple people and shaking hands and doing things like that.
So I know there's a lot of times people are saying, you know, the recommendations is large crowds. What is a large crowd? 30, 40, 50, 100? What's a large crowd?
That guidance changes every day. The governor's recent declaration said no mass gatherings over 100. The CDC.
That's a movie theater, right? So you think we should close movie theaters?
I be honest, I don't know what the guidance is right now for as far as movie theaters, and because this is changing so quickly, it's hard to say. From
a health perspective and emergency management perspective, right? What are some of the guidelines? I know that you don't have the authority to say this because you're not the governor. You're not the governor. I'm not the governor. But from a health perspective, what are some of the things that we should consider? You know, like one of the things I'm being faced with, and I was sharing it with you guys offline, is that, and I'm careful a lot of times about my opinion, but I've learned that sometimes I just have to give my opinion about some things. Like right now, give you an example. Right now, we're faced with evictions. By law, I have to serve these eviction papers. Mm-hmm. And in a time of emergency, in times of where we have declared a state of emergency, there are some things that I think we've got to be really transparent about and have real conversation and say, what is best practice? We know what's legal. We got to do what's legal. But sometimes I think our common sense and our intellectual ability should override some legal things sometimes. Because when you sit down and you start talking legal advice, legal this, they didn't take in COVID-19 because we just discovered it, this year? Last year. Right? Year. So we're operating under some old principles with new viruses, which calls for new policies, which calls for times of, okay, we got to make some decisions on the fly. We've got to adjust to what's happening now. So my question, to go back to my question, in your expertise, if you had this magic wand and I had a magic wand and you could tell me, sir, you're the genie, you're the wizard, here's what I think you should do that would make us safer. And if I had the wand, I would say, okay, so say my magic advisor is done. What would you give me? What would you recommend that I do?
Well, Sheriff, I'll
you
take
gonna let
that.
him think for a minute.
I'll give my answer first. I think one of the ones that, and we've talked about that, is just the community and public at large needs to have what we call a measured response, which means you're thoughtful about what your actions you're going to take and base that on the correct information. A couple of the rumors we've heard just in the past few days that I've had to respond to, one, that there was food shortages in North Carolina. That's inaccurate.
Please say that again, because I'm hearing that. Say that again.
At this time, we are not aware of any food shortages in North Carolina.
Thank you.
What happens typically every time the governor has spoken or the president has spoken, there's a giant run on stores. Also, there was a rumor going around that there's going to start being rolling blackouts and power outages. That is incorrect. We've confirmed that with the energy companies. There are no rolling blackouts scheduled. So I think sometimes people are making decisions, again, without the correct information. Obviously, we're in a different environment now with schools closed and businesses closing. So I think one way to answer that is people just need to take a measured response on how they respond. And things are different right now and maybe different for a few weeks. And how that looks 5 days from now or 10 days from now, I really don't know what that's going to look like.
Mr. I'm glad you said that there are no food shortages currently, because from going to the grocery store, you couldn't tell that. There are plenty of homes that have just stockpiled it, right? Charmin is nowhere to be found.
So it's kind of a self-fulfilling, it happens that way when someone reports that this store has toilet paper, everyone runs and grabs toilet paper even when they don't need it. Or if they report a store does not have toilet paper, and it's kind of crazy we even have to talk about toilet paper in official capacity, but
that's crazy, isn't
when
it?
Someone says this store is out of toilet paper, then everyone else makes a run on toilet paper at other stores. So we went shopping this weekend, normal payday weekend shopping, and all the stores had everything they were supposed to, except for toilet paper and hand sanitizer. So again, my answer to this, I think a measured response to really think carefully about what you're doing. Obviously, in this environment of right now, school for, no school statewide for 2 weeks, that's unusual. I don't know how long it's been since anything like that has happened.
Well, I can tell you in my 58 years of living, I've never experienced that, a school outage for that period of time, nor an ACC tournament canceled or NBA schedule canceled. But you know what's interesting when you talked about, so like you, I went and picked a few things up for the house the other day, and I couldn't find any bathroom tissue either. But I wasn't out. But so Saturday morning, I got up and I was going to Starbucks, and I said, hey, I'm going to swing in Walgreens. And so as I was going in, I saw this lady hurrying into the store, and I didn't pay her any attention other than she was moving fast. I said, well, maybe she has somewhere she needs to be. So when she got over to the aisle where the tissue was at, she literally grabbed, as if she was hugging a bear. And I said to myself, I just stood and looked at her because I was baffled. And rather than say something, because you have to be careful when you say something to people, especially people know who you are. Like, he was rude. I got into a disagreement with the sheriff, but I didn't say a word. I just looked at it in disbelief. And so I said, well, I'll just go somewhere else. So as I moseyed toward the back of the store where the Jergens lotion was and a few other things, I saw the clerk coming out of the back with a few rolls of toilet tissue. And I said, is there a shortage of anything? And she said, we're only putting out so much per day because people, once we set it out, it's gone. It's literally gone. And so I said, well, ma'am, I'm just going to grab just one if it's all right. And I said to myself, what's really happening? And I think you shed some light on it by saying that self-fulfilling prophecy. Someone goes and makes a phone call, hey, this store has it. And an hour later, it's gone. It's gone. And I'm glad you said that because that has been my fear is that sometimes panic creates chaos. Panic creates a lot of other problems that we would not have had panic not set in. So, Josh, what do you think we need to do? What do you think we need to wave this magic wand to say, hey, here's what we can do to avoid?
Well, I agree with August that we need to, to get our information from reliable sources. Like he's already mentioned, the CDC's website, the Department of Health and Human Services.
Off the Cuff podcast.
Off the Cuff podcast.
Yeah.
And so we need to be measured in our response. We need to be proactive about taking care of our own health, as I've already talked about those things like washing your hands and staying home when you're sick. I mean, I think that's important. And so listening to the guidelines that we've got as far as staying out of large public gatherings. That's now the governor has said that. So doing things like that, and looking out for your neighbor. I mean,
like that.
And who is your neighbor? And really, that's supposed to be everyone. All of our, not just the person that lives beside of us, but everyone is our neighbor. And making sure get what you need and get a little extra, but you don't need a 2-year supply of whatever it is. Food, toilet
the lady
tissue.
grabbed a year's supply of tissue.
So,
just
looking out for others is important because, because like I said, we're trying to look out for other people, and just to have that response where, there's a fine line. Obviously, some people will panic, and then other people are just their head in the sand, and neither one is correct. We need to have a middle of the road approach where we are taking it seriously. And if nothing else, you may be healthy and 35 years old and say, what does this affect me? Well, what do you know someone? Do you have a parent? Do you have a grandparent?
Right.
Do you have a neighbor that's kid is immune compromised and they're at risk? So, look out for others, looking out for your neighbor, whether it's the stuff that you buy or the places you go because you could expose someone.
Well, as we get ready to wrap up, Mr. Vernon, I'm going to give you the last word, then I'll go to Swift and I'll share my thoughts on it, and then we'll call it a day.
All right, so I think some just last thoughts. Again, just as Joshua said, just we need to take a community approach to this. This is going to obviously go on, we know, at least for a few weeks. And, one thing we've got a lot of questions about, should I get 14 days, 30 days of supplies? Our message has not changed. It's the same message I gave 20 years ago that I gave 2 years ago, that you need to have, every family needs to have 3 to 5 days of disaster preparedness kit. Some people call it a hurricane kit. And that's a more reasonable, realistic, informed process you can go through to make sure, hey, our family is prepared if something happens down the road, regardless if it's a snowstorm, a hurricane, a power outage, or a pandemic. This is unusual for everybody, especially even for those that have to make decisions on how we respond to it. But we've got a great partnership with all our community agencies.
That's true.
We do have, again, we're in daily conversation with the hospitals, with our healthcare networks. I talked to the school system probably about 5 times this weekend. We're having constant daily conference calls, go-to meetings. We have opened a very small coordination cell at Public Health, just with a few key personnel from Public Health and Emergency Management. In a typical event, we would bring a much larger group together to the Emergency Operations Center, but we're trying to follow those practical guidelines of don't make large groups come together. So I think, again, just have a measured response, be informed and educated about the decisions you're making.
Appreciate that.
Okay. So first, I need to, going back to the original question, you asked me to tell a little bit about myself.
Yeah.
And since this is the second time I've been on the podcast, I need to catch up. I want to thank my beautiful wife, who is from North Wilkesboro. We met at Appalachian, and we have two
You
kids.
didn't mention her last time, did you?
No, and I was called out on that, so I'm going to make sure to mention that. She works with the Guardian Ad Litem program, works with Judge Hartsfield, I think was on one of your previous episodes.
Yes.
So, one is, like I said, to be proactive. I already mentioned, like I already mentioned about my 82-year-old father, and then I have my in-laws who are in their 70s. We're not going to go visit Grandma and Grandpa, my kids, just for a few weeks because we just want to, make sure that they stay healthy. So, and going back to what August said, August and I we've been looking at this for months, and even before, I think I hadn't been here. I started November of 18. Probably within the first week or two, August reached out to me. We went and met for coffee. And, I talked about the last podcast, whatever the health issue is, whether it's the life expectancy and those social determinants of health like housing and food and jobs that affect the health of a community, or it's COVID-19, it's all about partnerships, better health through better partnerships. And we have been in contact. We had a meeting, I think it was early February. We brought our partners together, first responders, hospitals, colleges, universities, school systems. Then we had a large meeting, a gathering a month later where we had probably 70 people in the room. And now we've started to move that into a virtual meeting where we're having 60 or at least 50 or 60 partners on the phone. We're in contact with the State Division of Public Health, with DHHS, with the hospitals. So, this is something, as we talked about earlier, in 2009, we had our last pandemic in the United States, H1N1 or swine flu. A lot of people forgot about that just because our attention
11 years
span.
ago.
Yeah. So we're focused. So we got through that. We'll get through this. But again, it's for people to be proactive, have a measured response. Those partnerships, just to mention emergency management, working with the school system, the hospitals, the colleges and universities. Anybody else I'm missing out on? I think, there's so many, so numerous. So we're working together. Some things that we've done to try to be proactive. One, the health department, we have opened up today, and this is March the 16th, a helpline where people can call if they have questions. It's 336-582-0800. 336-582-0800. So from 8 to 5 p.m., there'll be a nurse who can answer questions regarding COVID-19.
Okay.
After hours, that number rolls to the state number. There's a state number that is a COVID-19 helpline, toll-free 866-462-3821, 866-462-3821. And again, we're encouraging people to use those resources for information on the phone, or to look at those websites like we've already talked about, the Forsyth County website, the CDC, or the Department of Health and Human Services.
Well, first of all, I appreciate you for coming. Also, I'm glad you cleared that up because I didn't want you to be sleeping on the couch. You didn't mention your wife last time. Mr. Vernon, Josh, I want you all to know something, that it means a lot, not only to me, but a lot to this community, that we have talented people that work together, people that pull their resources, pull their expertise together. And I think that one of the things that I love about this county is that we all work together, regardless of who we are, what silo we in, we come together and we make it happen. And as you said we will get through this. And I think that is the key principle. We will get through this. Not me, not you, but we.
If I could,
of
and
course.
if I could just say one more thing
Of
too,
course.
and August knows this too. We both, obviously, August being the director of emergency management, myself being the director of public health. There's lots of people behind us that are working right now while we're here on this podcast, that were working over the weekend, that are working every day, communicable disease staff, public information staff. I know he can comment on his staff that are working hard on this, because it's no one or two people.
Without question. It's truly a team. And like, I say a lot of times, and I tell people, is that it's no one-man team. It's several team members moving all the time. You may see one of you all, you may see me, but there's people doing what needs to be done to keep this community safe. And as I was saying, is that I'm grateful for you all, because it says a lot about this community. As we leave here, we got other meetings we got to go to. But I think it means a lot to the people that we're putting information out there. We're going to be transparent. We're going to give them information, because I think that when you talk to people and you give them information, that kind of soothes a little bit of the anxiety that they may have. It also dispels some of the rumors that you cleared up. It also encourages people that they have leadership in the room. They have leadership in the community. They have leadership that is addressing this problem. And so for that, I say thank you. I want to thank all of our listeners, all of our viewers, for taking time to watch the podcast on a weekly basis. But I thought it necessary to bring those persons, experts in the areas that we're currently in this atmosphere. But as I said on many occasions, that we're going to change this atmosphere, we're going to change this outcome, and we will get through this. And once again, thank you for joining us at Off the Cuffs. Have a great day, and may God continue to smile upon you, this county, and this country. Thank you.